Healthcare's Tina Verona. Well, in anticipation of a major winter storm, I want to make sure that you are all updated and that you have our link for all of the latest storm information. That would include the latest information regarding COVID-19 testing, as well as vaccine clinic operations, closings, and delays. So be sure to keep checking the link, hartfordhealthcare.org/storm. That's hartfordhealthcare.org/storm. That will be consistently updated with the latest delays and closings and all of that information. Well, in anticipation, as I said, of the storm happening tomorrow, a major winter storm, we have with us today, so happy to have with us Patrick Turek. He's Director of Emergency Management at Hartford Healthcare. And we also have Shay Ajay, Director of Operations at Hartford Hospital, alongside Dr. Ulysses Wu, who will take questions regarding COVID-19 questions after. But first, I do want to begin with Patrick to talk about storm preparations at the system level across the state of Connecticut for all 7 hospitals, as well as offices, and what it takes to prepare a system. Patrick, what's the latest?
Thanks, Tina. Well, the latest is we continue to monitor all of the forecasts and information that comes into our operations center to make sure we're that prepared for this particular emergency. If COVID-19 taught us anything, our organization has really become resilient and strong in a storm like this, while increasing in strength. Believe that we'll be able to continue to provide all of this typical service that we provide in those hospital-like spaces. But with that treacherous travel on Saturday, some of those ambulatory spaces, we may see some adjustments. Otherwise, our job is to ensure our organization is ready to plan for, respond to, and recover from all emergencies and disasters. And the Office of Emergency Management tomorrow will provide incident leadership and coordination services across our organization and all of the entities of Hartford Healthcare. Typically, we conduct an initial assessment about each emergency to see how it's going to actually impact us. I like to think of it as a balancing scale. During a normal day, the scale is in balance, where we can provide care and treatment for our patients without much disruption. Sometimes, based on an event or an emergency, that scale goes a little bit out of balance, and we want to bring that scale back into balance. The way in which we do that is informing our leadership teams, our colleagues, and our patients about what event is going to occur and some of those potential impacts. Given the impacts that we're going to have tomorrow on Saturday across all of Hartford Healthcare, we've convened leadership and incident management teams inside of emergency operations centers to respond and coordinate to the event. In those centers, they will reference their emergency operation plans and also make adjustments to those plans. Some of the specific items that we think about each day are making sure our colleagues can get into work based on the potentially dangerous travel conditions. And, you know, we've used the term so many times, but our colleagues really are heroes. Some will come in 8 hours before their shift to make sure that they arrive on time. And even after the storm passes us, some colleagues may actually remain in the hospitals to help other colleagues coming in. Or maybe not even be able to travel back to home. So again, our physicians, nurses, support service colleagues, public safety officers are digging back in to make sure that we can provide that service. Speaking of digging, our snowplow teams are ready for the task, checking the plows, the hydraulic equipment, all of the trucks to be filled with fuel, salt, and even our supplemental contractor crews going out to the hundreds of locations across the state of Connecticut, not only to make sure that we're cleared of snow on Sunday, but to make sure that on Monday morning, we're ready to go for those operations. Being out and about in the community, we also have emergency medical service teams and our ambulances that will be out on the road on Saturday, making sure that we can provide that support as well. I know Shay, who's also on the call, will agree and perhaps provide some additional information, but we also look at our critical infrastructure, our generators, our water supply lines, electricity, and with some of the forecasts with some significant wind and perhaps some blizzard-like conditions in southeastern Connecticut, electricity loss is always of concern to us. So our generators are tested, fueled, and ready to go. And while it's folks snow plowing or the critical infrastructure to keep the lights on, we need supplies and equipment to make everything run as well. So many of our deliveries of critical supplies are taking place today ahead of the storm as well. That's a lot of preparing that we've done inside of Hartford Healthcare, and we do that each and every time. And also just important for all of our communities and patients to be personally aware too. From a personal preparedness standpoint. So important to be aware of how emergencies might affect you. Plan for those events at home and think about what might you do if you happen to lose power or can't travel. And preparing just supplies and equipment that you might have at home, whether it's a flashlight to be able to see or some other food to last you throughout the weekend. We certainly encourage that. And then finally, just connecting with your community. Neighbors helping neighbors who might be next door to you that can help you out during the storm or otherwise. So I'm confident that Hartford Healthcare is well prepared to ensure that our operations continue throughout this weekend. We can care for patients. Our leadership teams, our colleagues, our doctors, nurses, and support service folks are all thinking about this event and feverishly preparing this morning, this afternoon, for this impact beginning tonight, and then certainly picking up throughout the day on Saturday.
Patrick, thank you so much for that global overview on what it takes to prepare a system. If you can take it one step further during the storm tomorrow in terms of emergency operations, what does that look like?
Sure. So we'll be constantly monitoring the conditions at each of the Hartford Healthcare locations. We have an emergency communication line so that in the event a Hartford Healthcare organization, hospital, or entity is befallen by an emergency, that we can quickly muster resources across our system to respond to that location. Like many of us may be doing, or folks who are viewing today, people will be hunkered down on the campuses on Saturday and responding to what comes to them. We prepare in detail for these events, but 10% of it is a little bit of improvisation. Sometimes you can't think of or create some of the events that happen to pop up, but our teams are so agile and resilient to respond.
It's interesting, Patrick, while the majority of the state will be hunkered down tomorrow as this storm makes its way through, and I understand between the hours of 10 and 6 it's going to be pretty bad, is that the healthcare workers and hospitals, we never close, and the healthcare workers will be coming into work, whether it be staying overnight, and I know accommodations are made for that. And Shay, I want to turn it over to you. What does it take to prepare at the hospital level? And I know cots are brought in for staff to start coming in early for their shifts to ensure that they are here at the hospital. So Shay, can you pick it up in terms of what it takes to prepare at the Hartford hospital level, the flagship hospital of Hartford Healthcare?
Yeah, thank you for the question, Tina. As you know, Hartford Hospital, as you mentioned, is the flagship. We have so many employees, and in order to make sure that many of our operations are uninterrupted and to make sure that our doors stay open, we have prepared cots. We've prepared many of our dorm rooms to be readily available for all of our employees who seek so, to make accommodations as such. Speaking of specific to the resources that we have on hand, whether it's additional linen supply, additional food, whether it's fuel or oil for some of our generators, those preparations have already been made to support and make sure that through these weather conditions, we're set and okay.
And Shay, what happens during the storm to ensure that our doors remain open like they have to be?
Yeah, Hartford Hospital specifically, let's say it's approximately 3 million square feet. That's a lot of roads. That's a lot of sidewalks. Many of our engineering folks will be, working tirelessly, effortlessly to help snowplow, shovel. And as Patrick mentioned a bit earlier, we've also contracted some of that work with many of our contractors to support some of that work around the campus and in-house.
Patrick, can you talk a little bit about the Care Logistics Center and how that really comes into play during winter storms like the one that we're about to see?
Sure. So our Care Logistics Center, really, if I summarized in one or two words, it's Hartford Healthcare's air traffic control center to make sure that we can find the proper bed and at the right time for any patient that might be in need, and no matter the criticality. So the Care Logistics Center that operates 24 hours a day and 7 days a week to make sure that we have the proper placement of any patient across our healthcare system. And really, that center, so important as we continue to respond to COVID-19, and had seen that surge over the past number of weeks. And thankfully, we've seen a bit of a reprieve in that sense. But again, whether it's during COVID-19, a winter weather event, or other type of emergency, they're critical to our operations to make sure that patients can get the right care at the right time and in the right place.
Very important. Patrick and Shay, thank you for that overview. And speaking of COVID-19, we're going to shift gears a little bit to Dr. Wu. If you do have questions for Shay, Patrick, or even Dr. Wu, which I know that you all do, please ask them in the chat, and we will ask them to our panelists in the order that they are received. But Dr. Wu, let's turn it over to you for a COVID-19 update across the system and the numbers that we're seeing, hopefully still going down.
Yeah, thanks, Patrick. I was hoping to get through a media briefing without talking about COVID, but that was a
No
nice
such
segue.
luck.
So leave it to a snowstorm to derail some of the COVID talk. So Tina, you're absolutely right. The COVID numbers are decreasing. We're at 384 today. I'll give you some of the numbers. We have 49 at Bacchus, 22 at Charlotte, 155 at Hartford, 39 at Midstate, 40 at St. V's, 63 at HOCC, and 11 at Wyndham. Our ventilator numbers are also decreasing. In the state, we are seeing nice drastic decreases in cases and ICU stays. The ventilators, like we've talked about in the past, there's kind of a sawtooth pattern in the state. Some of them have been going up, but we are decreased as compared -12 to the day before. We're starting to see, I shouldn't say starting, but we have been continuing to see a higher percentage of the incidental COVIDs, so people showing up in the hospital for other conditions. So that will continue to be, I think, our new norm going forward from here on out. As predicted, we hope that we will continue to see a long tail, like I've said, with the sawtooth pattern. Influenza numbers remain actually fairly low at this point as well. I guess I'll talk about the Ba2 variants because I'm sure we're going to get a ton of questions about that. So the reality is it's not a different variant, it is just a subtype of the Omicron variant, and all of the variants, including Delta, Alpha, Beta, Gamma, they all had subtypes. And so, but they've always been lumped into the one umbrella designation. And so right now they're keeping their eye on this Ba2, which may, from the most part, clinically doesn't really seem to be different. Maybe a little bit more infectious. There's about 20 mutations on it as compared to the original. But in terms of its clinical sense, it doesn't seem to be more dangerous or more, I guess, lethal at this point. The big worry is that they've been calling it the stealth variant, or I shouldn't say stealth variants, but stealth subtype. And what do I mean by that? There is the worry that it may be able to evade some of the testing that is out there at this point. But I think there still needs to be a lot that needs to be studied about this. As we understand, our current medications still work against it. The vaccinations still work against it. It's really not all that widespread, at least in Connecticut, and not really widespread around the country. There have been a lot of subtypes and variants that have come and gone, but not really much to comment on at this point, as they still want to collect new data. So that was cool. Anyways, let's see, what else could I talk about? I don't think there's really much else on the COVID front. We are, in terms of our monoclonal antibodies and our oral medication dispensing of Paxlovid and Molnupiravir, we're actually seeing some decreases in demand for that. which is normal because as you all know, the positivity rate is down, cases are decreasing. I should state that relatively they're still very high. So, you know, we certainly want all of these numbers down. I think the last question we're going to get is what are we going to see going forward? We had our distinguished guest, Dr. Hotez, on just recently, and everybody's in the prediction business. I tend to agree mostly with his. What we would like to see is maybe get this to an endemic phase where we see this maybe as a seasonal disease. It is way too early to call it that at this time. You have to remember in the summertime, which is when Delta appeared, that's when another variant appeared in unvaccinated. And he's absolutely right. A lot of these variants arise from unvaccinated populations. And so if we have significant unvaccinated populations on the literally other side of the world, which is the Southern Hemisphere, during their winter time, we may see the rise of other variants. Now, the natural extrapolation with Omicron possibly being more mild as compared to Delta, we shouldn't assume that the next variant is going to be less dangerous. Remember, Delta was more dangerous as compared to Alpha and Beta. And so we shouldn't assume that the next variant will naturally, from an evolution standpoint, become something that is less dangerous at this time. And we should also not assume that Omicron itself is not dangerous, because due to the sheer infectivity of it, we are still seeing lots of people who are getting sick, those who may have comorbid medical conditions or underlying medical conditions, as well as those who may be pregnant. They may be at worse risk for severe complications associated with it. So hopefully I answered a lot of questions. And so I will turn it back to you, Tina.
Yeah, we do have a couple of questions coming in, and BA2, obviously that's making a lot of news headlines lately. We do have a question coming in from Peter Yankowski from Hearst, Connecticut Media for you, Dr. Wu. There are initial indications that BA2 may make up as much as 16% of samples based on S gene dropout testing. Is this concerning? Will this alter the curve at all? Will it be a longer tail? Thanks, Peter.
Yeah, that's a good question. You know, in terms of the S gene dropout testing. So I don't know. I really don't have an answer to that. Will it alter the curve? It really depends. I mean, there have been a couple things that have come across that some variants that we were worried about originally, well, not worried, but kept our eye on. If you all remember, Mu was out there, and that kind of dissipated very quickly. Then we were worried about Deltacron, right, as a possible emerging variant. So I don't know. I mean, we tend to give the worst case scenario. Yeah, it could alter the curve and it could extend the tail as well. But as long as people are out of the hospital, that is really what benefits the population. Now, if it is more communicable, obviously it can be spread to other people who may be more susceptible, which is why we still talk about boosters, we still talk about vaccinations, we still talk about masking in certain social situations as well.
Question from Alex Putterman at the Hartford Courant. Endemic has become a buzzword lately. Would you mind explaining exactly what it means for a disease to be endemic and what that may look like in the future with regards to COVID-19? Thanks, Alex.
Yeah, so Alex, you know, we've spoken a lot in the past about other analogies, and I'm not going to use the swimming pool analogy at this point, but I will just say that maybe the whole pool won't be affected with endemic. And so endemic really applies to a specific population within certain boundaries. And so pandemic is obviously affecting multiple populations across multiple countries worldwide at this point. So endemic, it's I guess, I don't know if it's a buzzword, it's just something that we use all the time. But if the disease is endemic, then it's limited to a certain population. And so what we would expect to be endemic would be Northern Hemisphere infections, kind of like influenza. And then we would shift to endemic Southern Hemisphere population or infections for COVID-19. And it doesn't just apply to infectious diseases, it applies to many other disease states as well. So I think I answered your question.
All right, I don't see any other questions in the chat. So with that, oh, actually we do have a question from Peter from Hearst, Connecticut Media for Shay and Patrick. Police and fire agencies often ask people to stay off the roads during these weather events. Is that a message you'd echo on the public health side?
I can take that one if you'd like. I do believe, based on the forecast, that staying off the roads tomorrow is a prudent idea.
Great. And we have one more from Alex Putterman at the Hartford Courant. Can a disease be endemic and still cause major surges?
Yeah, absolutely. And we see that surge kind of every winter with a lot of the respiratory diseases as well. So yes, definitely. And I don't want to call endemic like a diet pandemic. It's not less. We still worry about everything that happens during the end when it's endemic.
All right. No other questions in the chat. So at this time, Shay and Patrick, we can start with you. Any final thoughts, final messages that you want the public and the media to know?
Just in general, Hartford Healthcare is well positioned and prepared for the storm that we're going to experience this evening and into Saturday. Again, I'd urge caution from the public on any Saturday travel. Allow those first responder communities, the public works folks with the plows to have clear space on the road. And, we'll be digging out on Sunday and be operationally ready on Monday to ensure that we have all the care resources ready to go for Monday. But our hospitals remain open and are there for our communities.
They never close. Shay, anything to add?
Yeah, just to echo your sentiments, Patrick. Hartford Hospital, Hartford Healthcare will continue to stay and run operationally. We're going to be functional, and we'll continue to support our community as best as we can.
Thanks, Shay. Dr. Wu, final thoughts?
There we go. Let's keep our foot on the pedal. Let's please get your vaccinations. If you haven't had them, get your boosters. It's really the best way to really protect yourself against Omicron. And remember, vaccinations is not just about yourself. It forms that protective bubble around you. It may decrease transmission to other people. We haven't had a lot of good news until probably the last week. And so I'm going to keep saying that it's going to be good news. There is a light at the end of the tunnel, maybe not the end of the pandemic, but maybe the end of at least this wave. But we want to do our best to make sure that another wave does certainly not happen at this point. Where our predictions lie, I can't say that we're going to go the rest of the year without something else popping up. And we can't say that the next variant is going to be less than Omicron. So let's just make sure that we are protected when it does happen, if it does happen. So, but it is positive news. And even though we still see a lot of people in the hospital, even though the death rate is still unfortunately very high, it seems to be getting better at this point.
We will take all the positive news we can get. Dr. Wu, thank you. Shay, Patrick Turek, thank you so much for joining us. Once again, I do want to reiterate that website, hartfordhealthcare.org/storm, that will have all of the latest information regarding storm closures and delays. It's consistently updated, so be sure to check that in terms of COVID-19 testing as well as vaccination. So once again, thank you all for joining us today. We will see you back here on Monday, but for now, be safe and be well.